It's time now for Countywide, a special presentation of Yavapai Broadcasting News. Join News Director Paul David and News Editor Philip Catafamo as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics in Yavapai County that affect all our lives. And now here's today's Countywide.
Hello and welcome to another episode of Countywide. I'm your host, Philip Catafamo. I'd like to thank you for joining me. On today's show, we're talking vaccinations, and my guest today is Yavapai County Health Department Director Leslie Horton. Leslie, welcome back onto the show, which is what I feel like your fourth or fifth time this year.
Yeah, I've been on a few times, but always happy to be here.
And we're always happy to have you. You are a wealth of knowledge and a very busy woman, and we are always happy when you can take the time to talk to us and answer our questions. And this week, it revolves around one of the big hot-button issues that has to do with COVID-19. It's vaccines. Let's start with this. Obviously, there has been a major uptick in cases in Yavapai County and probably throughout Arizona. Were you guys expecting this when the pandemic started? Were you expecting this when we started 2021 as well?
Yeah, those are good questions. And when the pandemic started, it started here in March of 2020, and we saw a peak in July, right around 4th of July weekend, where we had about 50 to 60 cases at our peak then. Here in December and January, we have seen, and it started in October truly, but leading into the holidays, we saw a gigantic spike in cases that has lasted for way longer than I ever would have expected. So no, I did not know what to expect with this pandemic when we got started, but Arizona recently was identified for a rather long time now as a hotspot in the world for hospitalizations as well as at some points our death rate, as well as our daily new cases. And so we've had days of cases in above 300 in a day. But we've truly averaged for several weeks since Thanksgiving, over 200 cases a day for the most part, or around 200. Finally, just this week, we are seeing a downturn. So that has been really encouraging for those of us that are keeping close track of this. Most weekends since Thanksgiving, we've had an average of over 200 a day. This week, after the weekend, when we were looking at numbers yesterday, we had 384 over a 3-day span. So about 125 cases a day or around there. I didn't do the average, but that was much better news than what we've seen in past weeks. And hopefully that trend will continue downward.
Yeah, you talk about sort of that, obviously in July, we were a significant hotspot here in Arizona with our COVID cases. And what was weird is right around the tail end of 2020, a lot of discussion was about those holiday gatherings and if they would significantly impact our cases. And it seems like you said, it did. But it is nice to hear that we are kind of on that reverse slope and starting to go down again, especially with the vaccine starting to make its way throughout the state.
Yeah, absolutely. It's good news. We did expect it to happen sometime around mid-January. I started getting a little nervous last week when it wasn't happening because it takes a little while after the holidays, after all those gatherings, to get these things to turn back around. Now without any major holidays or other than Super Bowl, any major events planned, hopefully, we can hope to see this downward trend continue.
Well, I'll tell you this, you don't have to worry about seeing me at any Super Bowl parties because my 49ers did not make it this year, and I don't want to see Tom Brady win number 7. But another highly kind of criticized topic regarding COVID-19 is masks. Should Yavapai County have been under a mask mandate? What are your thoughts on that?
That's a really good question, too. And, we have very mixed opinions amongst our leadership. And some agree with mandates, some don't. And as you've seen in our county, we've had about half of most of the Verde Valley is under mask mandates by their city municipal leadership. And then most of the Quad City Prescott area is not. And from what we've seen in looking at both sides is, there has been slightly lower rates of COVID in the Verde Valley. We've had slightly higher in the Prescott Quad City area. If you compare statewide, it's tough to say. It's some of those areas with mandates have had much higher rates than us. And some have had lower. And we do know that masks help for sure. And so I can say that whether mandated or not, we encourage in every way possible people to wear masks where they can't physically distance. If I've got COVID and you walk by me and I sneeze and I have a mask on, it's going to hopefully stop those germs from getting onto you and hopefully stop that spread. If we were working side by side for 8 hours in a day and wearing masks, if I have COVID, you're likely going to get it still. But it does have, masks serve a purpose. And whether mandated or not, I do hope that people will continue, even with a vaccine and this turnaround in cases. I surely hope people will continue those mitigation measures that we have in place and that we know work for stopping the spread.
And it does start and end, well, not necessarily end, but it does definitely start with wearing a mask and taking the proper precautions when you can. Of course, wearing a mask doesn't, like Leslie just said, doesn't necessarily guarantee that you won't get COVID, but it will significantly reduce your chances of getting COVID, and masks are extremely important. Another thing that's kind of popped up that made us a little nervous in the beginning, but is I don't want to say it's making us a little more relaxed, but it's still kind of weird that it's going on, is the new COVID variant that we saw pop up. I believe it started in England, and now it's starting to make its way around to different countries. What does this new variant mean? We've heard the news, more COVID cases we have, the better chance the current strain could change again and possibly make the current vaccine null and void. So with this new COVID strain, how protected are we with these vaccines, and what does this new COVID strain mean for us in general?
The new strains of COVID were probably expected because viruses do tend to mutate and create new strains as they proceed to spread. And so it's just something that we probably knew would happen. You never know how it's going to happen or where they'll crop up. We have had cases in the U.S. now, but very few. And those variants, I'm not exactly sure how quickly we'll see them reach us, but I do know that the vaccine companies have said that they are quite sure at this point that the vaccines will help to reduce symptoms of even the variants. So with the vaccines, you can still contract COVID-19, kind of like the flu shot. You get the flu shot, you hope though that vaccine reduces the severity and the duration of your symptoms. And oftentimes that's the case. If you have the right flu shot for the right strain of flu, you generally have very, very light symptoms, if any. So with COVID, that is the hope, is that people will not be hospitalized as much. If they are a vulnerable population, they won't have nearly as severe of their complications or even symptoms of COVID. Now, with the variants, though, what the vaccine companies are doing is we're pretty sure that people are going to need boosters for the vaccine. So we're getting the vaccine now. We still don't know exactly how long it'll boost our immune system. So down the road here, when they decide how long it does last to boost your immune system, there will be booster shots most likely. And with those, they're trying to work on booster shots that include better immune boosting against the variants as well. Okay. So it's an ever evolving process. So, we think we've got a handle on it. We've got a vaccine, we get it out there, and then all of a sudden things change. So I'm trying to get used to these game changers throughout the process and not get too comfortable at any point in time, that's for sure.
A lot of hurdles for Leslie Horton and Yavapai County Health, but we'll keep talking about those vaccines on the other side of this break. We will be right back. Don't go anywhere.
Two things we can count on every year:
a new set of tax rules and great weather here in northern Arizona.
Jackson Hewitt Tax Service, locally owned and operated by Lewis Rice since 1997, is here for you all year long.
Your neighborhood Jackson Hewitt Tax Office will help you in all of your taxing situations.
Electronic filing is always free with your tax preparation at Jackson Hewitt Tax Service.
Get more in return. Call 1-800-234-1040 for an office near you.
The EPA says C&B Construction ranks in the top 1% nationally. C&B Construction invites you to see what energy efficiency and indoor air quality can be. We have won another Department of Energy Innovation Award, and C&B Construction is the only contractor in the country to win 6 consecutive EPA Indoor Air Plus awards. Experience our zero-energy, move-in ready homes at Crossroads at Mingus.
C&B Construction, locally respected, nationally recognized. Find out more at candbhomes.com.
Been hearing about the crazy benefits of CBD? Find out how CBD can help you at Sedona's #1 resource, CBD Sedona. Come in for a free consultation and let our trained medical staff help you find the perfect product for you. Pain-relieving salves, full-spectrum oils, CBD skincare, bath bombs, and even CBD for your pets. Come on by CBD Sedona today.
Terrifying jobs, high-flying linemen, take 3.
Josh, this is an absolutely terrifying job. Why do you do it?
It's a very demanding job, but very rewarding and exciting.
How much energy are you actually working with up there?
500,000 volts of electricity.
It's definitely not my line of work. Does anything shock you?
Yeah, distracted drivers terrify me.
Hello and welcome back to Countywide. I'm your host, Philip Catafamo. On today's show, we are speaking with Yavapai County Health Department Director Leslie Horton, and we are speaking about the vaccines. In our first segment, we talked a little bit about the major uptick we're seeing in cases here in Yavapai County, the new COVID variant, and mask mandates. But now we're going to move to the vaccines themselves. And Leslie, a lot of people have talked about antibodies. When you get COVID, your body develops those antibodies to help protect you basically against COVID-19. Now, that does not mean that you're, again, immune from COVID-19 if you have those antibodies, but much like the vaccine, they do help. So I want to ask you this. If you had COVID-19, should you get the vaccine?
All right. Well, I guess I'm a good example of this. I did have COVID-19 back in December, right before Christmas. And yeah, it was made for quiet holidays. And so, in those cases, we've had a lot of discussion about this at the state and federal levels, and especially amongst those of us that are giving recommendations based on COVID-19. We do know that people get antibodies. And what we decided as a state of Arizona is to make a recommendation because of limited supply of vaccine, as well as the fact that we were not seeing any sort of reinfection rate within 90 days, so 3 months after having COVID yourself. We're recommending people wait 90 days to get the vaccine. Now, with that being said, if someone desperately wants the vaccine, a lot of people have had a really rough go of it when they've had COVID, and they want to make sure that they are protected for making sure they don't reinfect. They can get the vaccine a week later. So a week after symptoms subside, they can go ahead and get the vaccine. Now, those folks that I know that have gotten it soon after having COVID, the symptoms of the vaccine have been pretty severe. They still only last a day or two, but it can be a little nastier, a little more flu-like when you get that vaccine because of the response your immune system makes. So we're recommending 90 days out.
Very much like when you get the flu vaccine, you usually feel a little sick afterwards, correct?
Correct, yeah. A lot of vaccines are that way. That's your immune system at work, and it's bolstering your immunity against and your ability to fight off those infections as they show up.
So you may not feel great, but your body is definitely helping you out. Vaccinations, has there been an issue with supply? I know we're seeing a lot of vaccination events down in Maricopa County as opposed to here in Yavapai County and even Coconino County. What is the best way for people to get an appointment, and are we seeing a supply issue?
All right, yes, and I can explain how to make an appointment, but we are seeing a severe supply issue in Yavapai County. It's a nationwide problem. We truly have been given so many mixed messages from national media. I think even, it's very up in the air as to how much supply there really is out there of the current vaccines that we're using, Pfizer and Moderna. Here in Yavapai County, we use Moderna. in Phoenix, and especially in those big stadium events. I think you may have alluded to, we have some large stadium events in Phoenix where they're using Pfizer vaccine. That one is the more fragile one, the one that takes ultra low cold storage. So, this process is really interesting from a federal level on down to the local level, because Arizona was going to start losing allocation because Arizona as a whole had fallen behind early on in the vaccination process. So the state made the decision to support those large they're called point of dispensing pod events in the stadiums, and that dramatically increased our overall vaccination rate in Arizona as they were reaching people statewide, but primarily in Phoenix. On a local level, we have struggled with our supply of vaccine from the state. So last week, we were allocated 12,200 doses. We had plenty of supply. We couldn't even barely get our providers to utilize it all. Now this week, we were cut by 60% down to 5,000 doses, and I had to beg and plead with the state to get an additional 5,000 in order to keep up with the appointments that we've made at our pod sites. So we just got these sites set up, YRMC in Prescott, and they're in Prescott Valley too. They set up the old Sears building at the Gateway Mall, a pod event where they are vaccinating around 400 to 500 individuals a day. Okay. Spectrum Healthcare, that is based out of Cottonwood and Prescott, they have set up pods at the Verde Valley Christian Church in Cottonwood and at the Finlay Toyota Event Center in Prescott Valley. Their intent is to vaccinate at least 500 people per day. And we are posting, those events actually started this week. We're posting appointments as they're available on the Yavapai County Community Health Services website. We're trying to make that site as user-friendly as possible, but we're also walking people through the appointment process at our hotline. That's the 928-442-5103 number. And we're doing everything possible to make sure people get an appointment. Now, that being said, we'll have appointments open for a short while. They fill up incredibly fast, sometimes just as quick as we can get them up online. It's directing people to the YRMC and Spectrum schedulers, so it's not a Yavapai County scheduler, but we are working to get as many people booked as possible who are in the phase 1A or 1B currently. But people have to understand they book up really, really fast. And so sometimes there won't be any appointments available when they go to look for one. And so we will we recommend people check back on a regular basis and keep on checking until they can find one. Or our hotline operators are often calling people back when there are openings and booking them into those appointments. So even this weekend, our staff were doing that for hundreds of folks this weekend.
So it seems like there are opportunities to get the vaccine with these pods popping up, as you mentioned, in Prescott Valley at the Verde Valley Christian Church here in Cottonwood. Obviously, there is still the testing site in Fort Tuthill that I believe, this is for Coconino County, that I believe moved to Coconino Community College now. So Leslie, we've got just a little under a minute here before we head into our next break. Just kind of briefly, what do you know about this third vaccine? There's some rumors I've heard about Johnson & Johnson getting ready to launch a third vaccine along with the Moderna and Pfizer vaccines.
All right. I did want to mention, too, that the pharmacies and a few others are starting to provide vaccine this week, so people can look to their pharmacy and look to their healthcare provider as well. Okay. As for the Johnson & Johnson vaccine, tomorrow is the day that the Johnson & Johnson company is taking the information on their research with that vaccine to the FDA for possible emergency use authorization. That's a one-dose shot. And we'll find out a lot more about it once it gets its EUA. That's when they release all the data and let us learn more about it. But we do surely hope that that one becomes available. That will hopefully increase our overall supply and ability to vaccinate those in Yavapai County.
So possibly a third vaccine is on the way here to the state of Arizona and the entire world. So hopefully that will be able to start circulating around and we can get some more people vaccinated here, as Leslie said. If you want more information, you can visit yavapai.us. That is the county website, and you can go visit, get all the information you need regarding COVID on that website. Again, yavapai.us. We're going to take a quick break. When we come back, we will talk about those groups included in Phase 1A and Phase 1B and what Yavapai County hopes to accomplish when vaccinating those groups. All of that and a whole lot more on the other side of this break. Countywide will be right back.
Who doesn't dream of home improvements? Perhaps your kitchen, the real living room. Maybe the bathroom, where you bookend your day. Langstrand Contracting is your one-stop shop from tear down to finishing touches. With 35 years of experience, Chris and his team will work with you to match your family's style and budget. Call Langstrand Contracting today for guidance in bringing your vision to life.
Award-winning Soundbites Grill is an entertainment restaurant located in Uptown Sedona at the Hyatt Pinion Point Resort. Open for lunch and dinner, featuring fresh fish, all-natural hand-cut beef, even a full vegan menu. Family friendly, open 11:30 to 9. Late dining on Friday and Saturday. Soundbites Grill has some of the best views of the Sedona Red Rocks. Offers world-class entertainment, food, fun, and music.
Hi, this is Greg at Verde Solar Power. You know, Arizona has lots of clean, renewable sunshine, and we want to help you take advantage of it with our quality solar installations, and we offer to beat any written offer on a residential solar electric system. So bring us your electric bill and let us show you how solar power will save you money. We're located conveniently here in the Verde Valley and are dedicated to helping the valley go solar. So remember, the energy solution comes up every morning.
Starting in the late 1920s, Grandpa Gettle and his brothers laid the groundwork for what would become a family legacy. Almost 100 years and 100 patents later, Gettle's High Desert Mechanical continues to raise the bar of quality heating, cooling, and plumbing products and services in the Verde Valley.
Call Gettle's High Desert Mechanical Heating, Air Conditioning, and Plumbing at 567-2200 or online at GettlesHDM.com, providing solutions for your comfort. Don't settle, get Gettles.
Welcome back to Countywide. I'm your host, Philip Catafamo. We are continuing our conversation about vaccines with Yavapai County Health Department Director Leslie Horton. We talked about a lot in the first and second segment, but here in our final segment, Leslie, I've got one last question for you. When do we hope to have Phase 1A and Phase 1B of these vaccine groups finished?
Yeah, you know, Phase 1A, we're actually finishing out very soon. You know, this vaccine is optional for everyone. So some groups did not have a great redemption rate on the vaccine. And some, we've got folks that are waiting a little while and want to get the vaccine later. If someone chose not, that was in Phase 1A, chose not to get the vaccine yet, they can get it later. We'll still prioritize them. You know, and Phase 1A was healthcare providers, emergency medical services, and long-term care facilities. Most long-term care facilities have been vaccinated by Walgreens or CVS. There was a nationwide program that they could sign up for. About 80% of ours did. Those remaining have actually been vaccinated by some strike teams that, and we're still in the process of finishing those out, that are from YRMC. And then we have an agency called Maggie's Hospice in the Verde Valley that has stepped up to work on vaccinating those long-term care facilities, which is so important right now. That's where our biggest hospitalization and death rate comes from COVID, when it strikes those agencies, those long-term care facilities. And so with that, some of our healthcare workers this week are getting their second vaccination. So we started this process a month ago now, and excited that some of those healthcare workers on our front lines serving our most vulnerable will be vaccinated. Fully vaccinated at this point in time. And so Phase 1B, we did go ahead and open up. We had to sub-prioritize because of that limited supply of vaccine. We did prioritize educators and law enforcement and corrections workers first off, because was an accomplishable task based on the amount of vaccine that we had, and we needed those folks to be able to serve our communities. Our schools are so important. Our kids need in-class education, and then our law enforcement and those folks can't work from home. They've got to be on the job and interfacing with our public, and so we are actually now open up to 65 and over. Some counties in Arizona, they had the choice to choose whether they only prioritize 75 and older in Phase 1B. Here in Yavapai County, we are prioritizing 65 and older, along with all of the other groups like essential workers and others that are classified in Phase 1B. People can go to our website if they're confused about whether they qualify for vaccination right now in Phase 1B. But we have over 100,000 individuals in our county in Phase 1B. It's going to take some time, and that's where I think people have the expectation that if they're in that phase, they should be vaccinated today or yesterday for that matter. And currently our supply is such that if it remains very low, it's going to take us months to get through Phase 1B. Especially the group that is the over 65 individuals. A lot of them do want to get vaccinated, and it's going to take us some time. So I ask people to be patient, to work with us and understand that we will be continuing to proceed with vaccination clinics and offering as many opportunities as possible to get vaccinated. But it is dependent also on how much supply we receive from Arizona Department of Health Services.
Yavapai County Health Department Director Leslie Horton, as always, thank you very much for taking the time to educate us on this entire ongoing pandemic. Thank you very much. And with that, we are out of time, and I'm going to have to wrap up the show here. Leslie, again, thank you very much for coming on. We really appreciate you having you come on the show. I'm pretty sure we'll have you on again very soon. That is today's episode of Countywide. I'm your host, Philip Katafamo, wishing you a great rest of your week, and we'll talk to you again next time.